Okay, ma'am. You're welcome, ma'am.
Okay, hi doctor, how are you?
Hi, I'm fine. I'm Dr. Shehu Gandia here. You are welcome.
Hey, so how old is the patient?
Shekaran shi nawa ne, mama? He's 5-year-old child, male child.
Okay, what is the name of the family member that's with the child?
Me sunanki? Ke maman shi ne? Of course, it's the mother of the child that brought the child, and her name is Rabi'atu Yusuf.
Okay,
Hmm?
so is the patient a
The,
male or a female?
the patient is a male. This is her. Kidan matso ta inda ba haske. So this is the mother, and this is the child. It's a male child.
Okay, can you repeat the mother of the patient, please? Her name, please?
You said,
Can you repeat the mother's the patient of the mother, her name, the mother's name,
eh,
please?
yawa, wai me sunanki? Ki faɗa sun. Okay, as you heard, her name is Rabi'atu Yusuf.
Okay,
Rabi'atu Yusuf.
okay, thank you.
Thank you.
So, what made the patient come in today? Like, what symptoms?
So, mene yake, okay, mene yake damun shi da kuka kawo shi? Zazzaɓi, sai me kuma? Okay, ba ciwon kai ko ciwon ciki. Okay, zazzaɓin mai ci gaba ne ko kuma yana zuwa ya je ya zo ya je ya zo? Okay. Okay. He's having fever and chills. Chills means to be having cold, that the body will be shaking. Fever and chills. Tun
Okay,
yaushe? Okay.
okay,
Okay, for 2 days duration.
okay. Um, all right. So, is the fever continuous, or does it come and go?
Yes, according to her, the fever comes off and go as the day goes by. It's on and off, intermittent.
Okay, so it's intermittent. Right. Has the patient been feeling like headache or dizziness or a loss of appetite?
Shin yaron nan yana jin ciwon kai ko kuma yana ji baya jin cin abinci ko kuma yana jin jiri? Okay. Okay, there is no headache, no dizziness, and no loss of appetite. He eats well.
Okay. All right. Doctor, can you check the patient's
Hello?
temperature?
Okay. Okay. The temperature is 37.7 degree.
Okay.
37.7 degrees Celsius.
Okay. Now, can you check the patient's heart rate at intake, please?
The what?
The heart rate.
Pulse rate?
The heart rate. The heart.
Okay.
The heart rate.
The heart rate, okay. Yes. The heart rate is about 80 beats per minute.
Okay. So, is the patient, is he experiencing any diarrhea or vomiting? Hello?
Okay. He has no vomiting and no diarrhea.
Okay. Hmm. Is the patient feeling any abdominal pain?
Akwai ciwon ciki? There is no abdominal pain.
Okay. Um, so I think I have a diagnosis. I believe the patient has malaria, and to test that, I think we should do a rapid diagnostic test to see if the patient has malaria. Is that correct, doctor?
Very good, very good. That's excellent. I'm very happy you ask all the questions as if it's a consultant speaking, and of course the diagnosis is very beautiful. In
Thank you.
addition, sometimes we doctors like to classify malaria as simple or complicated. So based
Okay.
on the way he talks, it's just a simple malaria since there is no any features, any symptoms suggestive of complication. Just like you asked, is he having any dizziness or headache to show if there is anemia? He said no. Abdominal pain to see if there is involvement of the liver? He said no. Very good questions. You are on the right track. In
Thank
fact,
you.
you can do rapid diagnostic tests, which will give you either 1+ to show that is simple malaria, 2 or 3+ is to give you either a complicated malaria. And also, when you ask for the temperature, 37.7 degrees centigrade is fever, of course. That is malaria fever because the normal temperature usually between 36.5 to 37.2 or so is the normal range. So above that you get fever and below that you get hypothermia. It's beautiful. You are on the right track. And in addition to rapid diagnostic tests, you can also order the people in the laboratory to take the blood sample and do what is called blood microscopy culture and sensitivity. They will go and subject the blood to the microscope. They will look underneath the microscope whereby they will see the picture of the ova, that is the egg of the parasite, or they will see the some parts of the parasite, be it the proboscis, that is the part it used to suck the blood meal from the individual, or you see some part of the wings or the head, which is
Mm-hmm.
suggestive of the plasmodium, and they will diagnose it as also malaria. We are good to go. You are on track.
Okay. So, um, since you said it was simple malaria or uncomplicated malaria, I think for a treatment that we could do an ACT, and for the patient to prevent from getting uncomplicated malaria again, um, they should try to avoid mosquito bites and also use mosquito repellent and make sure to wear long sleeve tops and bottoms to protect their arms and legs, and to also schedule their visits during dry seasons. So, yeah, is that all, doctor?
Yes, yes, that's good. Yes. Usually these days, treatment is based on biopsychosocial approach. Having done
Mm-hmm.
the medical aspect, then you look at the social aspect of the environment, more especially also in the uh, African setting. You find out some people are living within poor settings, so the drainage there is very poor, which provides breeding ground for mosquitoes. So it's beautiful the way you advise them. They should drain their gutters. They should be wearing long sleeve, more especially in the evening. What is common with us is that a child will be playing until in the night, then the mother will use mosquito net for the child. While it seems in the evening that the mosquitoes will come out for blood meal, they have already beaten the child before the child is subjected to the mosquito net. So in the end, the aim is defeated. So they should be wearing long sleeve, most especially in the evening. And also they should invite on if the child is living in a malaria endemic zone whereby the malaria is very paramount, it's good to be giving them prophylaxis. Prophylaxis are medicines that we give to prevent occurrence of the malaria. And this child is between under 5 years. There are those that are more prone to malaria infection. So you advise the mother to make sure that she's taking the child for vaccination against other childhood killer diseases apart from malaria. It's beautiful. It's nice.
Thank you, doctor.
Thank you.
Um, hmm, uh,
We have digestive system, which has the mouth, the stomach, the intestine to the anus, and we have the respiratory system, which deals with respiratory difficulties and other things. It has to do with the lungs and the nose. So, is it digestive or respiratory?
um, I believe it's the second one that you said.
Digestive, of course. Digestive system should be the system because, you know, if it is respiratory, it's do with the lungs, the trachea, and the mouth, and of course the nose. That is where we breathe in. So if it is sickness like bronchopneumonia or COVID-19, you start thinking of the respiratory system. That's where it affects. But the digestive system is usually affected by malaria, because the malaria, when the mosquito takes a blood meal, it enters the blood. From the blood, it moves to the liver, where the parasite reproduces the young ones before it is released back to the bloodstream, and it can affect other systems also, like the circulatory system, which has to do with the blood and the way the blood is being manufactured and being distributed to the various parts of the body. So it's of course digestive and circulatory system. That's very interesting. You have tried, you have really tried. Thumbs up. I don't know if you have any other question to ask with regards to the patient.
I think that's all.
Okay, thank you. You're welcome. Excellent. I wish you be the next doctors in the US.
Thank
You're
you.
welcome on board. You're welcome. Thanks.